So hello, my name is Dr. Pai. I'm a GP and I'm Deputy Director of GPEG, which is the unit that delivers the GP placements and seminars for the medical students. This presentation goes through an overview of the course. I'll take you through placement activities, which include teaching surgeries, allied health professional sessions and tutorials. I'll take you through year 4, 5 and 6 in more detail, and we talk about the placement requirements and the sample timetables. I'll take you through also the accommodation and travel, and then next steps and FAQs. So first of all, the standard course is a 6-year course in Cambridge. The first 3 years are preclinical, leading to a degree in medical sciences with limited patient contact during this time, usually single days spent in primary care under the P for P, which is preparing for patients. The latter 3 years are the clinical years, and those are run through the School of Medicine, Clinical Medicine at Addenbrooke's. So year 4, which is the first clinical year, concentrates on the basic clinical method, and we normally stipulate certain numbers of students to GP ratio. So there's a 4:1 student to GP ratio for year 4. So year 4 is split into 4A and 4B. 4A is pre-Christmas, and those are 4 Fridays spent in general practice, and 4B is post-Christmas placements, and that's 2 fortnights spent in general practice. Year 5 is specialist medicine, and there's again a 4:1 student to GP ratio for that, and that's 3 fortnights over the course of the year, when the same students come back to the same practice for 3 times a fortnight at a time. Year 6 is the apprenticeship block, and that's normally 2 students to 1 GP for the ratio, and that's a 6-week block all in one go. So placement activities, firstly we talk about teaching surgeries because this forms the bulk of activities in the placements. Students are expected to work in pairs, actively involved from the outset, and that's to encourage experiential learning. That's for year 4 and year 5. For year 6 we encourage practices to actually put the students singly to consult with patients. So the types of surgeries is really it's split into 3. There's the observed, independent and observing. In the middle category is the independent surgeries, which is, again, what we'd encourage most of the activities to be, which is where the students are working, usually in pairs for year 4 and 5, singly in year 6, seeing patients around about 20 to 30-minute intervals. So the students see the patients, and then the GP comes in and does their bit after that. For the observed sessions, this is with a GP tutor observing and feeding back on the student consultations, again at about 20 to 30-minute intervals. Tutors may wish to do the observed session at the start, so you can gauge where the students are, and then set them off independently with the feedback. For observing sessions where the students are observing surgeries, we'd ask you that you limit these really to a maximum of a couple really over the course of the placement, with the students really observing the GP tutor with clear tasks in mind. So here's an example of a teaching surgery, the example of the appointment structure. So this is with 2 pairs, pair A and pair B. So set off pair A first, and then stagger it with pair B. So pair B starts 10 minutes after pair A. And so for pair A, they see the patient 1A for the first half an hour, then the GP comes in and does their bit. So during the time that they're seeing the patient, they could be taking the history. If it's a face-to-face, then they could be actually examining the patient as well. And then the GP comes in and as I say, does their bit. Pair B, they set off at 9:10, and then they have their half hour, and then the GP comes in and does their bit for the 10 minutes. And so it's kind of you're going between pair A and pair B. This may be a bit ambitious for new GP tutors, so we'd encourage that you just that you maybe start off slow and then with lesser numbers of patients, and then work up as the time goes by. But it depends upon it's individual really in terms of preferences. So next in placement activities is the sessions with the allied health professionals. So this could be the practice nurse, particularly useful if she's running clinics relevant to the block, such as chronic disease management or minor illness. It could be with the district nurse, pharmacist, physiotherapist, mental health team worker, midwife, health visitor. So if any of these allied health professionals, if they're connected to the practice, we'd ask that you arrange a session with them, and we'll go through the requirements for AHPs later on. If you are going to put the students with a receptionist, ask them really just to put in for 1 session in the first week with an active role. So So I'll go on to Year 4A. So this is a pre-Christmas placement in Year 4. Half of the day is spent in a teaching surgery, and the midday tutorial is there with pre-prepared slides. And then the other half of the day will be spent practicing assessment and examination skills. And the students may examine each other provided appropriate PPE is worn. So here's an example of the of how a day looks. So in the morning there's a structured clinical examination skills session, midday tutorial, and then in the afternoon there's joint teaching surgery. You can pause this if you want to look at this in more detail. So here's an example of the suggested timetable for Year 4A. So for each of the Fridays there's the morning surgery, then there's the lunchtime tutorial, and then there's the afternoon topic that's there as well. So Year 4B, the placements per fortnight, we ask that the practices deliver these particular activities, and there's a pick list here. There's a list here. So the list goes 8 teaching surgeries for each pair of students, 2 tutorials delivered to students in 4s. It could be 2 AHP sessions for each pair of students, 2 independent home visits per pair of students, 2 self-directed sessions per pair of students, and 4 opportunities to participate with the GP tutor on an acute home visit. And this can be delivered to the students in pairs. When we talk about participating in a home visit, this could be with the it could be with the GP doing the visit and then coming back and discussing it with the students. It could be with the students remotely logging into the consultation by either telephone or by video if that's possible. So the independent home visit, so this could be done remotely again. So previously students used to visit face-to-face with the patients, but it could be done remotely. So during the course of the placement, each student pair should review at least 1 patient on the admissions avoidance register and review at least 1 patient recently discharged from hospital. Again, Year 4 is basic clinical method, but with a focus on acute side of general practice. And students should have an opportunity to discuss these cases with their GP tutor and, if at all possible, contribute their findings to the practice MDT meeting. So here's an example of the Year 4B timetable. As you can see, there's 2 bars. Top bar is week 1, and then the bottom bar is weeks 2 to 4. And as you can see, in week 1, the students are in the clinical school on the first day for the seminar days, but for weeks 2 to 4 afterwards, they're in on Fridays for their seminars at the clinical school. Okay. And there could be, so talking about practice systems for acute presentations, it could be emergency surgeries, it could be on-the-day appointments as well. Telephone triage, we do that a lot now, so there could be acute problems that present through telephone triage and then siphon through to the patients to talk more. And then the duty doctor could identify appropriate patients with acute problems. So moving on to the self-directed study sessions, these could reflect on the portfolio of cases seen in surgery, completing their improving health population profile, which is run by the public health team. So you may be asked to contribute to this, but you're not meant to run it. So students are asked to explore specific patient practice demographics and integrate their clinical knowledge with population health skills. So they'll submit the findings using a template on MedEd, which is the virtual learning environment, for review by the public health team, and students should discuss their findings with you and other relevant members of the team and be prepared to present their cases on the 4th seminar day. So really what it is they see a patient and then they think about how it pertains to the wider public health and then tie that in with the demographics of the practice and discuss things discuss wider themes really. Year 5 is specialist clinical practice, and there are 3 specialty themed blocks. 6 weeks in hospital and 2 weeks in general practice for each of those blocks. General practice teaching is linked wherever possible to the specialty block, but general practice being general, the patients don't often come in the blocks which the students are in. So we just ask you to signpost those patients or the topics and say, this is a patient with X, therefore it's relevant to the block to this block. And the blocks are specialist surgery. So the students spend 2 weeks with oncologists at Addenbrooke's, and then 4 weeks in a student-selected surgical specialty. And then the next block is neurosciences and mental health, NMH, and this is 2 weeks with specialist neurosciences at Addenbrooke's, and then 4 weeks in psychiatry. And then for specialist medicine block, it's 1 week with infectious disease at Addenbrooke's, 1 week cardiology at Papworth, and then 4 weeks with their student-selected medical specialty. So after each of those specialty blocks, then they spend the 2 weeks in general practice. So there's 3 fortnightly blocks, 6 weeks. So that's in total 6 weeks per year for the students. They're with you 4 days per week in general practice, Monday to Thursday. You get the same students throughout the year, and really, if anything, they one of the things they asked to do is to produce a personal portfolio patient case, and this is a longitudinal case study. And the students follow 3 patients on 3 occasions. So that's once per fortnight block that they follow their patients. As well as a PPP, there's a clinical audit which we ask them to come to do, and that's an opportunity and give them an opportunity to present at practice the clinical meeting. So for each Year 5 fortnight placement, the content that we ask to be delivered is 8 teaching surgeries delivered to the students in pairs, 1 session with an AHP, preferably relevant to the specialty block, 2 sessions for self-directed study, and that could be for them to work on their audit or PPP, 1 session for the PPP, with the students visiting in pairs, and that visit could be face-to-face or virtual, whichever one's most appropriate, and then 4 tutorials with a GP tutor delivered to students in 4s. And here's an example of a sample fortnight timetable. So as you can see, there's 2 pairs there. So week 1 is at the top and week 2 is at the bottom, and then it's divided into pair A and pair B. And as you can see, on each of the Fridays, they're with the practice Monday to Thursday, and then on Friday they're at the clinical school. The light blue coloured bars are where the tutorials are, and as you can see, for week 1, Monday could be actually a remote day with the induction and in the morning, and then for the afternoon for both pairs there could be a PPP and audit brainstorm. And then if you can see in week 2, for week 2, the Monday you could have a tutorial for both pairs, and then in the afternoon is self-directed study for both the pairs. So they're only on site Tuesday to Thursday in this sample timetable. That you can still satisfy all the requirements that we ask of placements in that time. So how can we link the learning to specialty blocks? Well, signposting cases in surgeries is the first thing, as I mentioned earlier. It could be the AHP session as well. So for NMH, which is neuroscience and mental health, if you have a mental health worker who comes to the practice or visits the practice, then that could be one of the sessions that's relevant for that. The PPP case could be a mental health case or a patient with cardiorespiratory illness. For the audit as well, it could be a subject relevant to the specialty. And tutorials, as I mentioned, they plan relevant content if it's a formal session. It could be reviewing the audit work, specially invited patients, or relevant case-based discussions as well. Year 6 is the apprenticeship block, and this is 6 weeks spent in general practice. 2 students per practice, and the outcomes that we ask is really to consolidate learning through the student-led surgeries, primary care management of common ENT, derm and ortho problems covered, and then completion of a reflective portfolio case, which is an end-of-life case as well. And for each week in Year 6, we ask that they do 8 independent student surgeries per week, and that's for each student with 1 GP supervising both students. 2 tutorials per week, at least 1 on ENT, derm and optho, and then 1 session self-directed learning, and then 2 to 3 opportunities to participate with tutors on visits, with a tutor on a visit. And that participation again could be, as I mentioned before, either face-to-face if that permits, or it could be remotely, or it could be with the GP tutor coming back and discussing the visit with the students. And we put at the end plus or minus 1 session with the HP if it presents a new learning opportunity, but the students may not wish to, may think that actually they've had enough sessions with the HPs from previous years. So the Year 6 sample weekly timetable is here. And again, as you can see, the first day could be a remote day with an induction or tutorial in the morning, and then a self-directed session in the afternoon for the same thing. So they're on site Tuesday to Friday. So we'll talk about travel and accommodation. So for any placement that's really more than an hour's travel outside of Cambridge by public transport, we classify those as residential placements. And so students may ask for accommodation for those. So the student is responsible for pre-agreeing with GPEG, that's us, any train travel they wish to claim for, and we refund up to 8 return journeys per attachment. And For the practice, well, we ask that you arrange taxis if they're required to and from the practice. If, say, for instance, students arrive at the train station, then if you could kindly pay for the taxis, keep the receipts, and we'll reimburse that. If taxis are required to and from accommodation, again, we would reimburse you for that as well. And we also ask practices to arrange accommodation, preferably self-catering. So this could be Airbnb, and we stipulate about £150 per week per student for accommodation. Now, we recognise that accommodation may be limited, or it could be more, or it could be more expensive in areas as well. So, if you're finding that you can only source accommodation that's potentially more expensive than that, then please consult us. Just drop us a line, and we'll be happy to discuss this further with you as well. So, but we do ask that students are put in self-catering accommodation wherever possible. Again, if you're having difficulty sourcing self-catering accommodation, then please contact us as well, just to discuss this further. We do set accommodation and travel standards, and we have that in our teaching agreement, which I'll come to later. So next we'll talk about the support that GPEG provides its tutors. We run an annual GP conference. We also give you senior clinical tutor access to the clinical school intranet, which is the VLE. We have a team which has a dedicated support to placements, that's Julia Skinner, finance, Charlotte Stevenson, and then there are GP leads for each year. And we have a tutor development course as well, which is the IFME course. So frequently asked questions that we've been from past presentations. We're asked about indemnity cover, and students are strongly encouraged to take this, but are not mandated to, because the activities that they'll be doing shouldn't require indemnity cover, but they are strongly encouraged to do so. Smart cards, all students are issued with smart cards in their fourth year, so to set the students up for access to the clinical system, when you initially contact them, you can ask for their smart card details as well. Safeguarding, all students complete mandatory modules on e-learning for health, including in Year 4, Level 1 safeguarding for children and adults, and later on in the year, the Child Health team pick up Level 2 safeguarding for them. Equality and diversity training, fire safety, health safety and welfare, moving and handling, data security awareness and infection control are covered as well in the modules. From an occupational health perspective, all blood tests and immunisations are handled by the University Occupational Health Department in the preclinical years. For COVID-19, all students have been offered immunisations, and all those living in colleges and on hospital placements are asymptomatically tested. DBS checks, all students have DBS checks on entering colleges in the preclinical years, and the original certificate is given to the students. Next question is a couple of questions. Can students be taught with GP registrars? We say no, really, as the two are on different stages in their learning. Can students be taught by general GP registrars? As a rule, no, but unless I suppose some trainees have particular depth of expertise in areas that are relevant to student learning, so that's permissible in those particular circumstances. So the next step, so we produce a practice visit report, and we email that back to you for factual accuracy. In terms of that's our quality assurance process. Once the report is finalised, we sign off a teaching agreement, and I've put for this year, particularly the production of this video, it's in for July 2022, so it covers the whole academic year going forward. And then we schedule the students. So practices in advance of the placement starting, contact the students, design the timetables, and you can look at the GP tutor handbooks, and then make necessary any accommodation and transport arrangements as well, if it's applicable. And that's the end of the presentation. Thank you.